I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided and can be fixed by managing to modify our faulty lifestyle. Today, we have with us Dr. Nikhila P. is a well-known doctor who specializes in dermatology. She's MBBS, MD, DNB, and MNAMS dermatologist and hair transplant specialist. She has a wide range of expertise as trichologist, dermatosurgeon, aesthetic dermatologist, and in cosmetic procedure. Dr. Nikhila has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing specialized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Nikhila is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Nikhila, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you. Thank you for the kind words of introduction. And thank you, Ipka, for having me here.
Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, today we are going to discuss the most common problem is nowadays is hair care in current scenario. So when we talk about hair care in current scenario, the most common problem is hair loss, irrespective of gender, age. So, Doctor, can you please enlighten us today for hair loss, what's normal and when to be concerned for?
Normally, when we say hair loss, we first think about a scalp hair. So that's where we begin. Scalp contains 1 lakh hair follicles, out of which 90% are in the growing phase, that is the anagen phase, and 9 to 10% are in the resting phase, that is at least about 3 months. And usually the 1% or less than that is in the shedding phase. So that comes to around 100 hairs. So losing less than 100 hairs per day is absolutely normal. But in a normal, healthy individual with no other comorbidities, leading a healthy lifestyle and no stress like that, usually they lose about 25 to 30 hairs per day. So if your hair loss is more than 100 hairs per day, or if it occurs in a pattern, like it's like an M pattern with vertex loss in males, or is in a widening of central partition in females, or if it is localized to an area like alopecia areata, or if there is loss of eyebrows or lashes or body hair, then it should raise up concern among patients.
Okay, so Doctor, more than 100 is like not like is alarm signs. We should visit to the doctor.
Yes, you should consult your dermatologist. Along with that, you should do the investigations which they give for you, and along with that, the treatment, and they will decide which type of hair loss you are having. So, okay.
Okay, doctor. So now that we know what's the alarm sign for the hair loss, so another question which comes up to our mind is what are the general causes of hair loss? Why does it happen?
Yes, that is the most important question in this in this session we are dealing today. So we can elaborate on that. There are 2 types of hair loss. One is non-scarring and one is scarring. Non-scarring means there is no scar. Does not form any scar on your scalp. So that is the most common type. And among that, the most common type is the patterned hair loss. The patterned hair loss can be of 2 types: female pattern hair loss, which occurs obviously in females, and the other type is male pattern hair loss or androgenetic alopecia, which is in males. So that's the most common type. The second one is alopecia areata, that is focal hair loss, focal areas of hair loss, which usually occurs in children and in the younger age groups. Then Third one is telogen effluvium. Telogen effluvium is that which occurs as a result of any acute febrile illness or following pregnancy or any other stresses. There is a diffuse shedding of hair. I'll come into detail of each after the classification. Then the other type is hair loss related to fungal infections. That is especially the inflammatory type of fungal infections. Then the next type is the chemotherapy induced hair loss, and these are the most common non-scarring type of hair losses. And the scarring type, that is which causes death of the tissue of the hair and the complete loss of hair follicles, so that if you again treat the cause, the hair will not come again in that area. That is the meaning of scarring. So scarring hair loss, it is rare, but it occurs in lupus erythematosus, that is a discoid lupus erythematosus. There is thickening of an area of the scalp, along with that redness and hyperpigmentation occurs, and there the follicles are completely damaged and hair is completely lost. So after your treatment, the area of hair loss will not get new hairs there. That's the problem. Then again, lupus, again, another one is lichen planus pigmentosus, means pilaris. That is, it will directly affect the hair follicles. Lichen planus affecting the hair follicles and again causing hair loss. Again, the next step is used in only in the axis of cancer related hair loss. Then there is chronic folliculitis. That is, follicles gets inflamed and then it results in loss of hair if not treated. Then there's a condition that trichotillomania, that is speaking of hair, which in the early stages it becomes scarring type of hair loss. In the something happened, I don't know. Sorry for the disturbance. In the late stages of androgenetic alopecia, that is patterned hair loss also, it can be scarring. So coming to the non-scarring hair loss in detail, the male pattern hair loss most commonly, usually it started to occur in the age of 35 to 40 years, but nowadays it has started occurring early as 18 years onwards, and there will be a positive family history, especially on the side, or father may be having androgenetic alopecia. And along with that, the hair loss starts in an M pattern over the frontal area, and gradually the M becomes a C type, and then it joins with the vertex area of hair loss, and to the end of the alopecia areata, that means androgenetic cell, it becomes it retains only the occipital hair, which is not lost in androgenetic alopecia. Visibility of the scalp. Then gradually this partition widens. So that occurs usually in females of age group about 30 plus with a positive family history, and sometimes there may be underlying thyroid disorders or polycystic ovarian syndrome. So these are the most common type of hair loss. And the telogen effluvium, again, it is a common type which is associated with a variety of nutritional deficiencies, including the micronutrients and vitamins and minerals, etc. And it's associated with the acute febrile illness. Patient may have had an episode of fever which requires hospitalization, and after 3 months of the episode, the patient will complain of hair loss, and it usually lasts for 2 to 3 months. It may resolve without treatment, but it will be good to give treatment for the patients. Again, in pregnancy also, due to the progesterone high levels, the patients have been for a long time, and after it, this progesterone withdraws during the 3rd to 6 months post-delivery. So during that time, the patient develops hair fall. And it's also like you can treat it with the supplements like iron and calcium, and along with the hair supplements. Again, the alopecia is usually in children or young adults. In children, it is usually associated with atopic dermatitis, And in adults, among adults, acute some related stresses can induce alopecia areata. It is like a small oval or round area of hair loss, and it gradually enlarges in size if not treated. Another type of hair loss, it is trichotillomania, as explained. It's like a obsessive compulsive disorder, slightly pertaining to the psychiatric category. Then it has to be treated with antidepressants and anti-anxiety medications along with hair supplements, if you can go for that. Then another one which a dermatologist concerns are fungal infections. That is more common in children, especially the inflammatory type, that is Kerion and Favus, which occurs as boggy swellings over the scalp along with pus discharge that can damage the follicles and results in hair loss. So these are the most common non-scarring forms of alopecia. Scarring forms has already been discussed. So this, in a nutshell, is the other causes of hair loss. And again, body hair loss can occur in hypothyroidism, thyroid-related conditions, then diabetes mellitus, lupus erythematosus, then also in nutritional deficiencies and Hansen's disease, that is leprosy. So, and in alopecia areata also, there is a condition called severe alopecia areata, that is alopecia totalis, where your whole of your scalp care can be lost. And in alopecia universalis, even body hair may be completely lost. And there are various genetic causes of hair loss, which is another extensive topic, usually seen in children, which we can deal with it later on.
Very informative, doctor.
So this is about causes of hair fall.
Yes, now that, doctor, we know the causes of hair loss, one thing we want to also know that can a person lifestyle play a role in hair loss also?
Yes, because in the patient's lifestyle nowadays, it's like where there are various stresses. Environmental stresses are there, financial stress, work-related stress, family-related stress, etc. Along with that, there is an increased consumption of fast food and also junk food, that is known as a comfort food nowadays. And then along with that, there is a tendency for sedentary lifestyle, that is more of an office job type. Then that also, and also lack of exercise. All these leads to some hormonal changes in our body. That is, it raises the insulin levels. Fasting insulin levels will be raised. It raises the blood sugar levels. This all, and it also raises the blood pressure levels because of the stress-related increase in the hormone serum cortisol. So all these adversely affect the hair because this serum cortisol is inflammatory. That is pro-inflammatory, that causes inflammation in our body, and also stress releases various cytokines and various other hormones which directly damages the hair follicle. It causes an oxidative stress in our body which generates various free radicals and causes hair fall. And it has proven that in androgenetic alopecia and female pattern hair loss, there seems to be, there is a high level of fasting insulin levels, blood sugar levels, and blood pressure levels. So there is a direct link between androgenetic alopecia and female pattern hair loss. And also, this is the reason why we know that metabolic syndrome is nowadays in a rise in among patients like 30 to 35 years old. Again, the same, if we look into the pathogenesis, the same inflammation is occurring in the hair follicles also. So there is a direct link between this metabolic syndrome and the patterned hair loss. So only the pattern hair loss is directly related to lifestyle stresses and also alopecia areata. Other ones are not directly stress related, but the lifestyle, like crowded areas, that can cause excessive fungal infections. Okay, like that.
So lifestyle is also very important, and we should have a good lifestyle to improve our hair loss problem. So doctor, now that we know the causes and so many reasons are there for hair loss, so can you please also enlighten us what are the medical treatment option available for hair loss, like topical or surgical or non-surgical, or some oral is also there which we can take and manage our hair loss?
Yes. Usually, when a patient comes to us with a hair loss, we will determine what type of hair loss the person is having, and according to that, we will give the treatment. So, if it's like a pattern hair loss, we will assess the grade of the hair loss. If it is females, it is very easy, grade 1, grade 2, grade 3. But males, there is a grade 1 to grade 7. So, depending upon that, and also upon the patient requirement. So if the patient wants a sudden change in facial appearance, we'll go for hair transplant. So like that, it is depending upon the patients. But in the early stages, we usually give supplements. That is the hair supplements, which includes various omega fatty acids like that, various micronutrients, amino acids, give that day depending upon topical minoxidil is our first choice. But in some patients, especially in females, we may start with topical serums containing procapil, capixil, and again, etc. So topical minoxidil, in males, we start at a percentage of 5%. 1 ml twice daily is the maximum dose. And we will wait for at least 6 months for the results to happen. So if the results happens, we'll ask the patient to continue till whichever time the patient needs their hair, means to continue it. But sometimes if the patient does not respond, we may go for other forms of treatment. Like the add-on treatment which we do nowadays is the platelet-rich plasma therapy treatment, which is like taking the blood from the patient and then separating plasma-rich fluid and directly injecting it into the scalp. It can be done monthly or every 2 months. The advanced PRP is like growth factor concentrated PRP is nowadays available, which is relatively painless compared to the PRP treatment. Along with that, it is better. It has having a better results for the patients. So we go for that treatment. Sometimes we may switch to oral treatment. That is oral, along with the supplements, we give oral minoxidil 2.5 to 5 milligram per day, depending upon the patient's tolerability also, because there is a less chance, there is a low chance of BP lowering in some patients. So we have to monitor the BP initially. Usually sometimes give as low as 1.25 milligram, then increase the dose of minoxidil. And even finasteride is an excellent option for patients. Only we can advise regarding the side effects to the patients, like decrease in sexual libido. Otherwise, it is the best and safe option for hair loss management. Finasteride 1 milligram per day. And it has even minoxidil and finasteride has to be taken at least 3 to 4 months for the results to occur. And the results mainly occurs over the crown area first and gradually the and in females is slightly different. We usually do the investigations in females, especially serum ferritin is a very important test to be done in females. Usually, the females may have less iron stores in the body, which is shown by the ferritin. These ferritin levels, usual values like 10 to 200, but for adequate hair growth, at least the value of 30 to 60 should be there for adequate hair growth in females. So we'll check that, and if that's ferritin deficiency, we'll add iron tablets in their supplements along with the vitamin supplements, that is hair supplements. Also, vitamin D3 levels may be checked. Sometimes, actually, I don't usually check vitamin D3 levels. I just directly give vitamin D 60,000 units once weekly for 8 weeks. No, for all my patients, because most of the Indians are vitamin D deficient. And along with that, in females, we have to check the serum thyroid hormone levels, and that may be another cause for this hair loss. Again, we have to rule out PCOS, especially if there are other features like obesity, hair serums, and if the serums are not working, we'll go for minoxidil 2%. Along with that, we do ER treatment for teens. In alopecia areata, the most common management is topical or intralesional steroids. Topical steroids to apply daily, like Mometer. If that does not work, do not work, we give intralesional steroids. That is steroids at the border of the alopecia areata, so that hair growth will happen gradually. Like within 3 weeks, we can see the results. In fungal infections, itraconazole or terbinafine is a line of management. Then trichotillomania, as I already said, you have to refer to a psychiatrist. Along with that, antipsychotic medications should be taken. Then in telogen effluvium, again, what is the cause of the effluvium should be addressed. If it's an acute febrile illness, we can just reassure the patients, and we can give some supplements. If it is also post-pregnancy hair loss, again, reassurance and some vitamin supplements would be enough. Then if it is like any medical disorder associated, it should be corrected. Along with that, we can give the supplements. So this is in nutshell the treatment options. And if the androgenetic alopecia grade is severe, like grade 5, 6, or 7, we can go for a hair transplant.
Okay, doctor. So, doctor, nowadays, one word called nutraceutical is getting a lot of focus. So, can you also please enlighten us what is nutraceutical and what is the role of nutraceuticals in our hair health?
The nutraceutical are health as well as beauty supplements, which are now available OTC as well as a prescription way, and it is regulated by FDA. But the very well-defined studies have not been done on the molecules. So this usually is phytochemicals. That is, you might have heard about various these preparations like curcumin, then this ashwagandha, like that, then saw palmetto. It's a very common agent now is used in some such as sage oil, evening primrose oil, then inositol, choline, etc. These are usually the phytochemicals. Efficacy in hair loss, but not as such as the chemicals like minoxidil and finasteride. This can be used either topically or as oral supplements.
Okay. So, doctor, yeah, so like you said, nutritional supplement. So when we talk about nutritional supplement, there are a lot of nutrients like macronutrients. So doctor, can you enlighten us what are these and role of micronutrients in our hair health?
Yeah, there are a lot of micronutrients which are important in hair loss. Usually the common people think that just biotin is enough for hair. Like that is why I think they depend a lot on biotin gummies, which contains just biotin and maybe some zinc or something like that. But that's not the case. There are various micronutrients which are important in hair growth. So most common ones are vitamin D. Then vitamin C and D also has a minor role in that. Then omega fatty acids, iron, calcium, zinc, copper, selenium. Then lesser role for vitamin A, also biotin, B12, and folic acid. So these are the most common micronutrients which should be included in a hair nutritional supplement. So detailing each, vitamin D is very important for cell cycle. That is, the hair follicles are actively dividing cells. So vitamin D plays an important role in cell cycle signaling. That is, from where the cell should go to through the which like that depends on activity. So it has importance, but vitamin D are severely associated with hair loss. And again, next one is this omega fatty acids. That is what I told earlier. These borage oil, then evening primrose oil. These are high sources of omega-6 fatty acids. They have anti-inflammatory roles, antioxidant role. Along with that, they are important in the well-being of the hair follicles. So that is the role of these omega-6 and omega-3 fatty acids. Again, also in times of stress, there is an increase in stress hormone levels, and that can be decreased by these omega fatty acids. It's important for skin also. Again, then next is vitamin A. Again, that is important for cell cycle and cell differentiation. So in skin, the cells differentiate. The stem cells differentiates into keratinocytes. That is the skin cells. But in hair, it has to differentiate into hair follicle cells. So that is determined by this vitamin A. Then vitamin E as antioxidant property, it protects the hair cells from oxidative damage, stress-related damage. Then other micronutrients, iron. Iron is very important because iron is involved in the oxygen carrying capacity of the blood. So to the micronutrients and oxygen to reach the hair follicle, iron is a very important cofactor. Then copper, zinc, selenium, these are other micronutrients which are involved in the various enzymes which are associated with the hair cycle. Then, as I've told, the minor other ones are vitamin B12 and folic acid. Again, as these hair follicle cells are rapidly dividing, these B12 and folic acid are involved in nucleic acid DNA production. So again, this is important. Biotin, it is known as the hair vitamin. It catalyzes various enzymes involved in the hair follicle cell synthesis. So these are the role of micronutrients in hair in the growth of hair.
Okay, doctor. So, doctor, like there are so many nutrients and so many products are available on the internet. So, can we take it by ourselves, like
Yes.
self prescription, or is it required to take this nutrients as per gender RDA requirement?
Yes, this recommended daily allowance, that is the RDA, it specifies the required amount of nutrients in normal adult healthy individuals. So that has been calculated based on various standards. So it is better to take these nutrients in a recommended dose, because over the counter preparations may have, I am not saying it does not have any results, it may have results depending upon the amount of the micronutrients these molecule which these products may be having. But as a doctor, as a dermatologist, for the well-being of my patients, I usually recommend patients to take this preparations based on this RD recommendation, that is as by prescription from a dermatologist or another doctor like me.
Okay, doctor. So, doctor, like nowadays, another problem after hair loss, which we commonly see, is dandruff. So, does dandruff also cause hair fall?
Actually, this dandruff is caused by a fungus known as malassezia, which is normally present over the body, over the scalp, face, and upper part of our body. It is a fungus which just lives on our body. But if it is in excess, then it causes inflammation. Then it causes the body to react to it. When, like, specific number is okay, but more than that, it causes the body to react, and that reaction is what we see as this dandruff. The dandruff appears as scaling, redness, then small follicle, then small papules, the small lesions that over the bud, or even the face, brows, eyelashes, etc. That if it is severe we need to that result in hair loss. Otherwise, so it simply does not cause hair loss. This dandruff directly will not cause hair loss, but indirectly, because of this inflammation and scaling, or if the patient is having severe itching sensation and the urge to scratch, and if the patient scratches severely, that can result in hair loss. And also, it can cause hair breakage also. That is the most common thing we see, especially in patients. They have false but it is not the fungus which is not causing.
Okay, doctor. So, doctor, like yeah, earlier you said that stress can also cause hair loss. So, can you please enlighten us, like, what is the impact of stress in our hair health?
This stress-related hair fall, it is usually, as I told, is usually associated with alopecia areata. That is but common in children and young adults. In adults like us, the stress-related hair loss is seen nowadays. It is seen in androgenetic alopecia and female pattern hair loss. Stress plays an important role in hair loss. It releases various cytokines like TNF alpha, interferon gamma, etc., which directly causes oxidative damage to the hair follicle cells. So that can result in hair loss. Especially this one reason for androgenetic alopecia and female pattern hair loss to occur early in these conditions is means in this nowadays it is because of this role of stress. And stress also increases the serum in our body. This hormone can directly inhibits the hair follicle cells to grow. Whereas the hair follicle cells from in the growing phase, and also there is a supportive structure for each hair follicle that is made up of hyaluron and collagen. This cortisol decreases the levels of these molecules in the scalp. So that can also indirectly result in hair loss.
ओके डॉक्टर। सो डॉक्टर लाइक जब भी हम लोगों को स्ट्रेस होता है, स्ट्रेस एक ऐसी चीज है जो कोई भी अवॉइड नहीं कर सकता, तो हम लोगों को मम्मियाँ ये सजेस्ट करती कि बालों में ऑयल लगा लो, मसाज कर लो एंड बहुत ऑयल लगा लो ताकि बाल भी अच्छे लंबे और घने ग्रो करेंगे। सो व्हाट डू यू थिंक डॉक्टर, ऑयलिंग हेयर इज अ बून और अ बैन? डज इट हेल्प इन अ हेयर ग्रोथ?
Oiling hair, actually, the oil that is coconut oil, it's composed of short chain fatty acids. It cannot, it's a large molecular weight thing, so it cannot penetrate the hair follicles. But the result we see after oiling is that there is a vigorous massage which is going on there. So during that massage, there is an increase in blood flow which carries all the micronutrients which are necessary for the hair growth. That is why that's the result you get. But sometimes we may add some ingredients to this hair oil. Some may get absorbed into the hair follicles, like some plant extracts we may add into this oil which we prepare at home. So that can slightly may increase the hair growth, but not to an extent that the minoxidil and finasteride can give. So oiling, to some extent, it is good. Like massaging with oil 15 minutes per day, or like every 2 or 3 times a week, it's good. But daily oiling can actually, it can worsen the dandruff. If you have dandruff, it's better not to oil your scalp daily. Excessive oil promotes the growth of fungus, and thus it can worsen the dandruff. But complete absence of oil, especially in the winter, that can also worsen the dandruff. If you have a dry scalp, that can worsen this dandruff. So it has to be kept at a, you should know your scalp type. Some scalp may be dry, some may be oily. You should know that, and according to that, you should oil your scalp. And again, the oiling the strands can actually moisturize the strands. That helps. This roughness of the hair is due to the cuticles becoming rough. So if you oil your strands, hair strands, that can help in the moisture to retain in your strands, and it can give a condition effect on your hair.
Okay, doctor. So, doctor, there are like you also earlier said, there are many nutrients and so many names you have taken. So, can you please also let us know that plant extract like grape seed and
Yes.
do they promote hair growth?
Yes. Actually, to some extent, these green tea extract, grape seed extract, borage oil, millet seed extract, saw palmetto extract, these have shown to have a mild inhibition of the dihydrotestosterone levels. They inhibits this 5-alpha reductase enzyme, which is involved in conversion of testosterone to dihydrotestosterone. This dihydrotestosterone is the thing which causes the male pattern hair loss. So in those with male pattern hair loss, these have shown to inhibit these DHT levels, thus reversing this androgenetic alopecia, but not to an extent like finasteride. But still, those who are to take finasteride, this palmetto extract, this borage oil, again green tea extract, grape tea extracts have shown benefits. Like if the finasteride benefit is like 80 to 90%, this may benefit like 30 to 40% only, but still it will have an effect rather than not taking anything. And along with that, green tea extract contains epigallocatechin gallate, which is a molecule. Again, it is a high potent antioxidant. It can reverse the oxidative damage which occurs on the hair follicles. Again, these grapeseed extracts contains various omega fatty acids, vitamin A, vitamin E, beta carotene, etc. Again, these are anti-inflammatory and antioxidant properties.
Okay, doctor. So, doctor, finally, can you give us some important tips for healthy hair?
I would advise my patient to lead regularly, then sleep 5 to 6 hours per day. Some relaxation techniques like meditation or yoga. Even exercise itself, it's a form of relaxation. Read some good books or self-help books. Even just reading something itself is a form of relaxation. And again, consume food rich in various these micronutrients which I have described, like seeds, yellow, green, or means red, orange, all the vegetables and fruits to include in your diet daily on a daily basis, because these all contain very minimal amount of nutrients, not according to this our day guidelines, but it will be very less. So we have to consume it daily and a lot, and quit, like you can decrease the junk food intake or the fast food intake you are doing. And for hair, you can do take supplements. You have to check your vitamin D, then thyroid levels, and take your supplements. Like I would advise my patients, normal healthy patients, there is no deficiency. I would advise at least once a year intake of vitamin D. That is, as already mentioned, weekly once 60,000 international unit capsules for 8 weeks. That is for that year. The next year again at the same time you have to repeat that. And for hair supplements, you can take. I usually ask my patients to take like 10 to 20 capsules in a interval of 2 to 3 months. That will be very good for hair.
Yeah.
Sorry, something I
Yes, yes.
and you can do, if it is a dry scalp, you can go for a sulfate free shampoo. So that you have to do like every means weekly twice. That's all. And you can condition your hair if you are using a shampoo. So these are the important tips for healthy hair.
Okay, doctor. Thank you so much, doctor. This discussion was very informative. I'm sure our viewers would be benefited by it. So, doctor, can we take some live audience
Yes,
questions?
yes, sure.
Okay, the first question from our live audience is, Doctor, my daughter is 12 years old and she goes to school, but currently she's facing a problem of gray hair. She's just 12 years old. Why is she having gray hair and little bit of hair loss is also there? What should I do?
First thing for gray hair, you should look if there is any family history of gray hair. That not that age when the parents were around that 12 to 20 year old. If there is a positive family history, again that may be associated with vitamin deficiencies. We have to supplement calcium pantothenate, all the micronutrients which are essential for hair, as I mentioned above, and along with that you can use means vitamin D also should be supplemented. Vitamin D levels can be checked. Also thyroid hypothyroidism is another cause for gray hair, and all these can be checked and that can be taken. And along with that, there are some repigmenting solutions, lotions available, that also you have to give along with that, and the treatment should be continued at least for a minimum of 3 months for the result to happen. Usually the results will occur like within 6 months. The result will be like there will be no more extra gray hairs. The condition will not worsen. That will happen. That usually if you consult a dermatologist and take the treatment as I mentioned, it will get better. She'll get better.
So these kind of premature hair, gray hair can be reversed?
Yes, it can be reversed in the sense that that strands that may not get reversed, but we can, by supplementing these, usually it is caused by 90% of cases are caused due to this nutritional deficiency. So by supplementing these, we can to an extent we can like stop the progress of the gray. Yes.
Another question from our viewer is, Doctor, I'm facing androgenic alopecia, and doctor gave me vitamin and minerals to manage my hair condition. So do I need to take these medication for my whole life?
Not for whole life. Usually, as a like I see more of hair patients in my clinic. Usually, I give for 3 months at a continuous like daily, and then I ask the patient to do it on an alternate day. If there is improvement, usually there will be some improvement, like as I told, 20 to 30% improvement. But androgenic alopecia is just not the cause. The cause is not just nutritional deficiency. It is like it is a there is a genetic factor and there is a hormonal factor. So you will have to switch on to other modalities of treatment like minoxidil or finasteride or some oral finasteride, or even PRP treatment, or sometimes if it is a grade 7, you may have to go for hair transplant. But if you would have asked a question about minoxidil or finasteride to continue, yeah, it would be for a lifetime, but not supplements. Supplements you have to take like 3 to 4 months at a continuous stretch. Then like after 6 months you can again take for 2 or 3 months, like that. That would be enough.
Okay, doctor. Another question from our viewer is it safe to color or bleach my hair, and how can I minimize the damage?
Actually, coloring or bleaching, it's an artificial process because the normal melanin of the hair is getting it is removed by bleaching, and then you are coloring your hair. That can weaken the hair strands, and there is a breakage of the sulfide bonds in the hair that can lead to breaking of the hair strands gradually over a period of time. That by the protection means you can use hair serums, various hair serums containing various argan oil, then macadamia oil, and various other silicones are there available, but it will protect only to some extent. All of the patients, all the persons who have done this hair color and who have come to me says that the hair has become brittle. So it is a fact, and even then, even if you know the truth, and then if you want to go and color your hair, it's your wish. Like that. It will damage your hair, that is for sure, because there is a chemical process which is involved in that.
Yes, doctor. So another question from our viewer is, which all female wants to know. How can I protect my hair from damaging the effect of heat styling tools?
To some extent, like you should not heat style if when the hair is wet. One thing is you have to make sure about that. Then you have to condition your hair before you apply any heat styling tools, and even after that you have to regularly use like sulfate free shampoos. That would be better for your like thinner strands. And again, you have to look after your diet also. As I've already mentioned, you have to include various foods which are beneficial for your hair that may protect from heat damage to a certain extent by making the hair strands stronger.
Okay, doctor. So because we are running out of the time, so I'll just quickly take last question. Doctor, क्या आयुर्वेदिक मेहंदी लगा सकते हैं बालों में ग्रे हेयर को छुपाने के लिए?
No problem. Ayurvedic, the naturally prepared mehendi is okay. The other one which is available is Kali mehendi. It contains PPD that you can apply, but with after doing a patch test only.
Okay. Okay. So usually people don't like their gray hair. So mehendi is the last option because color can damage the hair.
Yes.
Okay, doctor. Yeah. So, Doctor, would you like to give our viewers a take-home message or any other suggestion to our viewers today?
Uh, as like I'm a person who loves curly hair and my hair is curly, so it's better you just appear to others like the way you are. That's what I tell my patients. And the next thing is protect your hair by taking care of your whole health, like as I told earlier, um, about the food intake, then about the sleep, about reducing the stress, and about exercise.
Okay, so
And
good.
take your supplements, that also.
Yeah,
Take your
because there,
supplements.
yeah, there because there are so many supplements on internet, and we just buy it because everyone promised that we'll have a long hair.
Mm.
So,
But that it's better to consult a dermatologist or a trichologist, and then what is needed for your hair they will know, and then they can guide you. Just once you have to visit. Don't have to visit like regularly. You have to once or twice you have to visit your dermatologist, and she or he will advise you what is needed depending upon the degree of hair loss you are having and the type of hair you are having.
so instead of self-prescription, we should at least give one visit to our doctor.
One visit.
Thank you so much, Doctor, for sharing so much on information and all your expertise with us today and answering all the questions of our viewers today. I'm sure our viewers have found the session very helpful. Thank you, Doctor. It was delight to have you, and thank you so much for your valuable time.
Yeah, I'm also very grateful that the you people asked me to chair a session like this. Thank you so much.
Thank you so much, Doctor. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today. Thank you, Doctor. Bye bye.
Okay, thank